Hi, my name is Delaney Hayes, and I'm going to be talking about legalizing marijuana in the state of Indiana. I am going to begin with some facts that I found about marijuana. Medical marijuana is legal in 33 U.S. states, including the District of Columbia and Puerto Rico. States allowing legal recreational use include Alaska, California, Colorado, Illinois, Maine, Massachusetts, Michigan, Nevada, Oregon, Vermont, and Washington. States that allow restricted use only include Alabama, Georgia, Idaho, Iowa, Kentucky, Mississippi, Missouri, North Carolina, South Carolina, Tennessee, Texas, Virginia, Wisconsin, and Wyoming. Indiana has discussed potentially legalizing marijuana. However, it has not been passed as a law. So facts continued that I found for marijuana is that marijuana is produced from a female cannabis plant, also known as the sativa plant. In the female cannabis plant, there are more than 500 chemicals, including more than 100 compounds that are chemically related to THC. When ingested or inhaled, these compounds bind to specific receptors in the brain and nerve cells, which slows pain impulses and eases discomfort. The two most prevalent compounds are delta-9 tetrahydrocannabinol, also known as THC. THC is what gives people the high in marijuana, and cannabidiol, which is also known as CBD, does not give people the high. Some more facts that I found was that medical marijuana is often considered safe when used as prescribed in short term. Common side effects include dry mouth, impaired mental function, and heart and blood pressure problems. Even though marijuana is a mind-altering drug, it does not appear to have a lasting effect on cognitive function in adults. Medicare and other insurance carriers do not cover medical marijuana, and in this case, many individuals should really consider the cost and all the money that they might have to put forward for this medical marijuana. First reason that I found for legalizing marijuana is chronic pain. There are three primary types of pain: nociceptive, neuropathic, and central. When body tissue is damaged, your cells produce endocannabinoids, a very unique type of neurotransmitter that regulates inflammation and pain sensation through interaction with cannabinoid receptors. These receptors are the same receptors targeted by cannabinoids or chemical compounds in marijuana. Medical cannabis may be useful for the kinds of chronic pain that people who survive catastrophic traumatic accidents have to live with for the rest of their lives. This could include PTSD, several different types of events. This is beneficial because the individuals potentially are not going to use a drug and become addicted to it. The second reason for legalizing marijuana is gastrointestinal issues. Marijuana is effective in relieving nausea and vomiting. Studies have shown that pharmaceutical cannabis can decrease nausea caused by chemotherapy used to treat cancer and almost completely eliminate vomiting. Marijuana can help treat appetite loss associated with conditions such as HIV, AIDS, and certain types of cancers. The third reason I found for legalizing marijuana is autism. 14 states, along with Puerto Rico, have approved medical marijuana for autism, and some additional states may allow it for autistic people at a doctor's discretion. As of right now, there is only one cannabis-derived drug that has been approved by the U.S. Food and Drug Administration, or the FDA. This drug is called Epidiolex. Epidiolex is a liquid cannabis extract containing purified CBD, which can decrease seizures in people with severe forms of epilepsy that is accompanied by autism. Epidiolex has success in extracts for seizures, behavioral issues, and other autism-related traits in children. The fourth reason that I found for legalizing marijuana is to help with anxiety and depression. Cannabis significantly reduces ratings of depression, anxiety, and stress. A survey done in 2016 states that 58% of users say that they use marijuana to treat their anxiety. A survey done in 2012 states that 2/3 of college students with high social anxiety reported that they smoke marijuana to help them cope with social situations. Scientists at the University of Buffalo have been looking into marijuana to treat depression caused by chronic stress. The school's Research Institute of Addictions has been focusing specifically on brain chemicals called endocannabinoids. They discovered that chronic stress may suppress the brain's production of endocannabinoids. They found that this can lead to depression-like behavior. The fifth reason that medical marijuana in the state of Indiana should be legalized is seizures. Epilepsy and other types of seizures can be relieved by Epidiolex, which I discussed earlier. Studies have shown that CBD will decrease seizure frequency in children with treatment-resistant epilepsy. My sister-in-law has a brother who has frequent seizures, and they have discussed potentially using CBD oil and or medical marijuana to decrease his seizure frequency. The reason that I found for legalizing medical marijuana in the state of Indiana is chemotherapy. Marijuana for chemotherapy and the cannabinoids in it seems to have benefits in treating cancer symptoms and cancer therapy side effects. The side effects of chemotherapy that medical cannabis can influence include mood disorders, nausea, vomiting, anorexia, weight loss, fatigue, constipation, sleeping disorders, sexual function, itching, and pain. In conclusion, marijuana should be legal in Indiana because the medical benefits outweigh the addictions that can be caused by other drugs or alcohol. Even though many people talk about the side effects of marijuana, the benefits in the cannabis plant help reduce those overwhelming sensors in the human body. There are several side effects of many other drugs, but marijuana has very few that can be taken care of easily. Even though marijuana is a mind-altering drug, it does not appear to have a lasting effect on cognitive function in adults.